Good morning, everyone. We're going to get started now. First and foremost, I'd like to thank you for making the time to join us this morning. I know it's a very busy time for all HR and finance professionals as we head into the latter part of the year, so we appreciate greatly your time and attention this morning. My name is Mary Kay Wagner, Client Manager at the Fidelity Group. Today, we're going to be talking about an important topic concerning engaging and empowering your Medicare eligible employees. Before we get started, I'd like to go over a few items to help you maximize your participation in today's event. You may have joined the presentation listening through your computer speaker system by default. If you would prefer to join over the telephone, just select phone call in the audio pane and the dial-in information will be displayed. You'll also have an opportunity to submit text questions to today's presenter by typing them into the questions pane of the control panel. You may send in your questions at any time during the presentation. We'll collect these and address them during the Q&A session at the end. Today, we're privileged to welcome our presenter, Kathy Herco, founder and president at CAS Company. Kathy is one of Ohio's preeminent experts on Medicare. She's represented a multitude of companies for over 12 years. You might have seen her featured on WKYC or WEWS on Sunday mornings, or heard her on WTAM 1100 radio. Knowing that Medicare can be an overwhelming and confusing maze, she works with people, educating them to find the plan that best suits their needs. Kathy's dedication to helping and education extends to her service to various boards and nonprofits. She's founder of the annual Fox 8 annual Stuff the Bus campaign and co-founded the Cleveland Kids in Need Resource Center. Kathy is an active board member of Boomer and Beyond and Coats for Kids. She was a member and co-chair of University Hospital Senior Network Board. Recently, we've had the pleasure to partner with Kathy and her team to bring them into the Fidelity Group family. It's been a privilege to join forces with Kathy. I've truly learned so much and look forward to our future together. Thanks for being here for us, Kathy. I'm excited to share today's agenda with you. Kathy will be covering the following topics. First, we'll be kicking things off with the common dilemma HR staff are encountering, which I'm sure you all can relate to. Followed by Medicare Basics. This will serve as a strong foundation before Kathy covers helpful strategies and resources to share with eligible employees. Finally, we'll open it up for questions and answers. So starting off, the HR dilemma. How did we get here? For the vast majority of people, the healthcare system and benefits in particular is a very confusing, complex maze. Most people spend the vast majority of their career accessing healthcare through their employer-sponsored health plan. This makes the role of the HR professional a critical piece of the healthcare system. And while we spend the majority of our careers relying on our employer-sponsored benefits, once we reach the age of 65 and shift towards Medicare, we're often left with very little in the way of resources and information about how to even start the Medicare process and how to make the best decisions for ourselves and our family. We at the Fidelity Group and CAS believe that this can and should be different. We believe that all employers and HR professionals fall into a unique position to be able to empower working Medicare eligible individuals or those retiring and heading into the next phase of their life to navigate the Medicare system in a way that's helpful to them and allows them to improve their decision-making power. We believe HR professionals are often left with very little in the way of resources, and our goal is to provide you with support and assistance to empower these individuals. And that's really what today is about. We think this is an important conversation, certainly with Northeast Ohio and Ohio in general being what they are, but also with a strain that is being placed upon working folks and folks that may be interested in retiring. We believe that makes this conversation extremely timely, and we're excited to share some information. With that, I'd like to hand it over to our presenter, Kathy Herko, to start with an overview of the HR dilemma.
Thanks, Mary Kay. Good morning, everybody. I am going to try and do everything I can to lessen any confusion that you have in regards to Medicare. However, I have had people tell me afterwards sometimes they have additional questions. And as Mary Kay said, you can submit the questions and we will try and answer them for you. Or if you would rather have a one-to-one conversation, feel free to give us a call afterwards. And we will then answer any questions or lessen the confusion that you may have. Some fun facts for you are, from now until 2030, 10,000 baby boomers will hit retirement age of 65 each day. That is very real. Most baby boomers are not exiting the labor force, unlike older workers in the past, with only 66% boomers aged 65 plus are retired. As I say to my mother, who is 91, Mom, were you doing it at 60 what we're doing at 60? She said, no, we're sitting on a couch or a front porch. We are still working. In the third quarter of 2020, about 28.6 million baby boomers born between 1946 and 64 reported that they were out of the labor force due to retirement. However, 40% of boomers plan to work until I drop, according to AARP survey. And I can tell you, when we meet with people who are 65 and older, that is what they say. Well, what am I going to do? Just watch TV? I am going to keep working. I will get some kind of a job, even if I leave my permanent position. 47% of Medicare beneficiaries and 57% of those nearing eligibility admitted that they are overwhelmed at the idea of finding the right plan. What we say is the more they read, the more confused they get. Many of those nearing eligibility don't know where to start and say official resources like Medicare.gov are confusing. Sure, it's confusing. It's confusing because it's something you don't know. 19% of Medicare beneficiaries enrolled in a plan without any outside help. A lot of times they'll say, my neighbor told me to get this, my sister told me to get that, I don't understand what I got, I just got it because I didn't know what to do. And half of Medicare beneficiaries and 3 in 4 Americans nearing eligibility will choose a plan based on affordability. That is very correct. What are the basics of Medicare? What is it? What isn't it? Medicare is the federal health insurance program for eligible U.S. citizens and legal residents. It is funded in part by taxes you pay while working. It is individual health insurance. And many, many people do not realize, even if they are the wealthiest or they are the poorest, they're going to have a question about Medicare as they are approaching the age of 65. What it is not a family health plan, meaning couples are on a plan together. We're not just talking kids. It is very individual. If one spouse gets one plan, it does not mean that the other spouse has to get the same type of plan, because 9 times out of 10, the spouses are not using their insurance the same way. It is not Social Security. One of the biggest pieces of confusion. Well, I'm not going to collect Social Security, so I can't get Medicare. That is incorrect. They can apply for Medicare and not collect Social Security. It is not Medicaid. As I think a lot of you know, Medicaid is for the impoverished, and it is not free. Part A is free as long as they have worked 40 quarters and paid into it, but Part B does have a monthly premium, and we'll touch on that in a bit. Okay, Social Security. I think a lot of us are familiar with Social Security. It consists of retirement, disability, and survivor benefits. And I want to touch on that really briefly for you. If you have an employee that has someone at home that is on disability 24 months, that individual is eligible for Medicare. And many times people go, I've kept them on my plan through work. They are eligible for Medicare, and many times it costs less for the family if they utilize the Medicare. So that's something that you may want to mark down. Social Security, you can start receiving benefits as early as age 62 or as late as age 70. And again, when you apply for Social Security will impact how much you do get. For retirement age depends on your date of birth. The longer you wait, the higher your monthly benefit will be. And you can get Social Security retirement benefits and work at the same time. So as we touched on, the year you get will tell you when the year you're born will determine the age you are eligible for full retirement. And as you can see, people that were born between 1943 and 1954, full retirement is 66. That means that is when their full Social Security kicks in. And then 55, it's 66 in 2 months. 1956, it's 66 in 4 months. So it really does depend. However, once you hit the full retirement age, if you choose not to get Social Security, your amount from Social Security does increase annually until you are at the age of 70. And pretty much that's my top line explanation of Social Security, because we do not focus on Social Security. Who can get Medicare? Legal residents must live in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. You must be age 65, younger than 65 with a qualifying disability, such as 24 months on Social Security disability. I apologize. I guess somehow we were disconnected, but we are back. So I was explaining what Part A was, and we're going to go back to Part A. Part A is inpatient hospital care, home health services, skilled nursing care, and hospice. It is premium free. It is premium free as long as they have worked 40 quarters. If they have not worked 40 quarters and paid into it, it is not free. However, if your spouse has paid into it, a spouse can collect off of their other spouse, okay? A husband and wife, a wife can collect off of the husband, husband can collect off of the wife if they paid into it. Does have deductibles and co-pays. It can't be denied coverage. Then there is Part B. That covers doctor visits, outpatient services, preventative service, medical equipment, home health, your MRIs, your CAT scans, your blood work. All of that falls under Part B. It does have a monthly premium, and the monthly premium is income-based. It is based upon the individual's tax return from 2 years prior. So if somebody applies for Part A, Part B in 2021, Social Security is going to go back to their tax return from 2019. And then it varies if you've applied as an individual, if you applied as, do your social tax return as married joint or married separate. And we can explain that to an individual on a one-to-one basis. It does have deductibles and coinsurance. Can't be denied coverage. You pay monthly from Social Security, EFT, credit card, or check. And there is a penalty for late enrollment. So the first thing I would like to expand upon is, if somebody is not collecting Social Security and they want to sign up for Medicare A and B, they will have to go to Social Security, call Social Security, or go on socialsecurity.gov to apply for Medicare A and B. They don't have to apply for benefits, but that's where they have to go to sign up for Medicare A and B. If somebody is collecting Social Security, they will get their Medicare card automatically when they turn 65, or if they're over 65, when they apply for Social Security. However, if they do not want Part B, why wouldn't I want Part B? I'm on my employer plan. They would then need to either opt out of Part B if they get the card automatically, or if they only want Part A, they would not apply for Part B if they are going in and applying on their own. And where we talk about the premium penalty, that is if you go within a certain length of time after you come off of an employer plan and you were eligible for A and B, there's a penalty involved. Medicare doesn't cover everything. There is a lot of confusion about this. Medicare does not cover medications. It does not cover routine dental, vision, or hearing, eyeglasses or contacts, hearing aids, long-term or custodial care, activities of daily living, bathing, eating, toileting, transferring, that is not covered by Medicare. Excess charges for services by doctors who don't accept Medicare assignment, care received outside of the U.S. except for certain circumstances. So a couple of pointers I'd like to state here. What people do not know, and again, I don't know if you in the HR department really want to focus on this. We can explain it to your employee. Medicare covers what is considered medically necessary. So if it's not defined as medically necessary, it is not covered. That's where you get into the long-term care, custodial care. I have a spouse going into a nursing facility. I have a spouse going into needing care at home, and it has to do with activities of daily living. That is not covered by Medicare because it's not considered medically necessary. Care received outside the U.S., that's where your plans will come in. They may pick up where Medicare does not. Okay, how much does Medicare cost? These are based on 2021. We're going into 2022, but we do not have 2022 information as of yet. Medicare hasn't released it yet. Part A is free as long as they've worked 40 quarters and they've paid into it, okay? The deductible, it's $1,484 as of this year. Other costs, $371 per day for days 61 through 90, $742 per lifetime reserve day, and there is no out-of-pocket limit. But where you're seeing these deductibles and these additional costs, that's where the Medicare plans that work with Medicare come in. That's where people can get the help that they need to fill in the gaps and the costs that Medicare does not cover. Part B, as I said, Part B does have a monthly premium. It is income-based. For the average individual, so right now, if a single person makes between $0 and $88,000 2 years ago, remember they go back 2 years, they would pay $148.50 for Part B. If a couple filed taxes 2 years ago and the married joint, and they made together between $0 and $176,000, they would pay each, if they were both going on Medicare or if it was one was going on Medicare, $148.50. So when you think about it, if somebody's going on Part A for free and they're going on Part B for $148.50, They have 80% coverage right there. And then there are plans that go with them that are not expensive, and they will get 100% coverage. So this is why that we recommend that you educate people that they may want to take a look at Medicare when they are still working. Currently, the Part B deductible is $203. Medicare does determine that. I will tell you, I have been in this business since 2008. In 2008, the Part B deductible was $141. Since 2008, it has crawled to $203. So it's gone up, but it has not gone up much. And then there's 20% of approved amount for covered services. That's your cost, unless you have a plan that will help you pay for that. Where can I get more coverage? Well, that's where Kaz Company and the Fidelity Group come in. We can help the individuals understand their options when they are looking at Medicare. Option one would be a Medicare supplement, which helps pay the out-of-pocket costs that come with original Medicare, and then a Part D prescription plan. So when somebody picks the supplement, they have 3 cards, 3 premiums, but they may have no additional out-of-pocket costs except for prescription copays, and the cost for the Medicare supplement, along with Part B, could be less than what they're currently paying for an employer plan. And if they don't want a Medicare supplement, also known as a Medigap, if somebody says I'm looking at a Medigap and somebody says I'm looking at a Medicare supplement, they are talking about the same type of plan. But if they don't want that, they can go on a Medicare Advantage plan. And a Medicare Advantage plan works differently than a Medicare supplement. However, it will fill in the gaps, the holes, and possibly give additional coverage, such as dental, vision, hearing, gym memberships, over-the-counter money, transportation to and from medical appointments. That can come with the Medicare Advantage plan, and that is what we do. We help people understand, excuse me, how these plans work. Because people will come in and say, okay, I'm accustomed to my employer saying, do you want Plan A or do you want Plan B? Now I'm looking at Medicare, which I do not understand. And then, oh, by the way, what do I want with Medicare? And under a Medicare supplement, there's a lot of plans. And under a Medicare Advantage plan, there are a lot of plans. So many times people will just avoid the whole subject because it sounds so overwhelming. But that's what we do here, is we help them to understand, educate and understand their options. What is Medicare Part D? This is a prescription drug plan. And as we tell people, just remember D for drugs. The average member, Medicare member, takes 4.2 to 4.5 prescriptions per month. There are some that take more, there are some that take less. They can come as a standalone plan with a Medicare supplement, or it can come with an Advantage plan. It may be incorporated in the plan. They do have formularies. What is a formulary? A formulary is a list of medications that the plan will cover. Medicare states that every plan must cover at least 2 medications in every category, which means they've got to cover at least 2 in diabetes, 2 for high cholesterol, 2 for high blood pressure. But not all plans cover all meds. So we do recommend that people pay attention to the formularies. There are now network pharmacies, which means that's where you go to pay a lower copay. They are offered through private insurance companies. There is a monthly premium. There are prescription copays. You cannot get away from prescription copays as much as people would like to. And some of the plans do have deductibles. Not all plans have all deductibles. 63 days to join Medicare Part D to avoid a late enrollment penalty. Okay, this is something that I'd like to give some additional information. In 2006, it was determined that anybody who goes on Medicare needs to get a Part D prescription plan, whether or not they are taking any medications. If they don't, because they're not taking any medications, they're only taking 2 and they pay $3 for them, and then all of a sudden down the road they wanted to get a prescription plan, they would pay a penalty for every month they didn't have a prescription plan when they were on Medicare, and they did pay that penalty the rest of their life. However, if they are on an employer plan and the employer plan meets the definition of credible coverage in the eyes of Medicare, they will not have to get a Part D plan, and they will not be penalized when they go to get Part B. So when somebody is 68 or 69 and they're going on Medicare and they're leaving an employer plan, the one thing that we say to them is you need to go to your employer and get proof of credible coverage. So if you would like a little more explanation of that after this webinar, we can provide it for you. But that is something that you would need to provide to them if they're going on Medicare and they've been on the employer plan.
Kathy, we had a situation here, I want to talk with you about this, where someone went on COBRA. They retired from the company, and rather than going on Medicare, went on COBRA, and discovered that COBRA is not considered credible coverage.
So the way COBRA works, there's a lot of confusion about COBRA. If an individual is working, actively working, and for some reason has COBRA, that is considered credible coverage. However, if they're not working and they're on COBRA, it is not considered credible coverage. And I will tell you that the Medicare industry, the health underwriters are trying very hard to get COBRA defined as credible coverage, but I don't know how long that's going to take. So the COBRA question, there's a lot of gray area in it, and I do recommend that if somebody has COBRA or they're considering COBRA, that they do a little bit of homework, because to Mary Kay's point, it may not be considered credible coverage.
Kathy, can you help understand, when you meet with somebody, how do you help them determine if they should go on a Medicare supplement or a Medicare Advantage? What are the different parameters there?
Well, and it's not a black and white answer, because a lot of things come into play when somebody makes a decision. Decisions can be made based on lifestyle, because some of the plans are networked and some aren't. Some people retire and they're going to get in a RV and they're going to go traveling, or they're going to go stay with their kids who are all over the United States. Some people don't ever leave the state of Ohio. It is based on income. It is, you know, some people, an Advantage plan can cost nothing to be on, and then you're paying copays. And if they don't want to spend the money, or they're used to copays, they may go on the Advantage plan over the supplement, because they say, well, I pay the premiums for the supplements. Some will make a decision based on the cost of their medications. We have so much money and my medications are expensive, so I'm going to pick this plan. And some people just say, I just want to write the check and I don't want to think about it. So there's all kinds of factors that come into play. It is not a black and white answer, and sometimes one spouse will go on a supplement and one spouse will go on an Advantage plan because they use their insurance differently.
So you really spend a lot of time meeting individually with each person to determine their needs and their lifestyle before you make a recommendation.
That is something that we do. We spend a lot of time with people, and sometimes it's not just once. Sometimes it's 3 and 4 times, because they're really having a difficult time determining what their priorities are. And once we educate them to the difference in the plans, types of plans, okay, and the difference in the types of plans, we will say to them, you know, you need to determine what your priorities are. Because on the Advantage plans, they may get $3,000 for a hearing aid. They may get $2,000 for dental. And sometimes people will say, I can't afford a hearing aid, so I'm going on that plan. Or they will say, you know what, I don't want to do that. I just want to get a medical plan and forget about it. So we really spend a lot of time on the education part.
And you can also help educate people that are working once they turn 65 to determine which is best, if they stay on the group plan or if they go on Medicare.
We do recommend that when somebody is approaching Medicare age, or that they've passed Medicare age, that they take the time to compare. What's the cost of your current employer plan versus your cost if you go on Medicare? And we can usually, we've got a certain group of questions that we can ask them. Well, pretty much once we hear certain things, we can say to somebody, you may want to take the time to look at what it costs to go on Medicare. You may be surprised. And then there are those that say, okay, but I'm comfortable on the employer plan. I'm not ready to make a change, but at least they are aware that they can. So we do recommend that everybody who is becoming Medicare age at least takes the time to do a comparison. And there is no cost, no obligation for them to do it. It's an education for them. Okay, and what enrollment periods? There's a lot of different enrollment periods. What is the initial enrollment period? Okay, so I am turning 65, and as people will say, I started receiving information in the mail about 11 months before I turned 65, 9 months before I turned 65. The initial election period is 3 months before they're 65, the month that they are 65, and 3 months after. So it's a 7-month window. So if I turn 65 in March, my 3-month window is December, January, February before, the month of March, and 3 months after, April, May, June. However, if I do my homework the 3 months before, my Medicare does not start till I turn 65 in March. That's when it would start, March 1st. When can I enroll? Okay, Medicare supplement, a Medigap. I've left my employer plan, or I'm out of it. I don't have an employer plan. Your guaranteed period for going on a supplement is 6 months after you turn 65 or enroll in Part B. We ask no medical questions. And I've had some people come in, and the only reason why I know they have medical issues is they will say, I just left the hospital 2 days ago, I'll never get covered. I've had people say, I was just diagnosed with a major illness 2 weeks ago, I'm never going to get covered. As long as you do it within the enrollment period. And that is something that we can help people understand when we meet with them. May enroll in a plan later, but could be denied or charged more based on health history. If you're out of your guaranteed issue, depending upon when you sign up, you may have to go through medical underwriting. SEPs, special enrollment periods. That means you're working past 65, okay? The month after the last month of employment or employee health coverage. That's to enroll in Medicare Part A and B. You get 8 months. However, you get 2 months to enroll in a Medicare Advantage plan or Part D prescription. So when somebody comes into us and they say, my employer plan ended, if they want a Medicare Advantage plan or they want a Part D prescription plan, it's really 63 days. Why the extra 3 days, I have no idea. But they have 2 months Otherwise, they have to wait for an annual enrollment period to sign up. And they would unfortunately end up getting penalized. Okay, so this is where there's a lot of confusion, and we may have Mary Kay touch on this, because HSA accounts, there's a lot of confusion about working past 65 and having an HSA. So can contribute to HSA up to 6 months before enrolling in Medicare. To be able to contribute to an HSA after age 65, you must not enroll in Medicare. At age 65, you can take penalty-free distributions from your HSA for any reason. However, in order to be both tax-free and penalty-free, the distribution must be for a qualified medical expense. So the first thing I want you to know is, if somebody even signs up for Medicare Part A and they have an HSA, they can no longer contribute to that HSA. And if they have made a contribution within the 6 months before, they will get hit with a tax penalty. And I recently just found out why, because I never understood why. But when you apply, when you are over 65 and you apply for Medicare Part A, Medicare Part A goes back several months. So that's why, if Medicare Part A goes back several months, that's why they hit you with a penalty, tax-wise.
And Kathy, if they do apply for Medicare Part A and want to contribute to the HSA, can they stop Part A?
I know you can stop Part B, but I don't think you can stop Part A. And I mean, that is something that people need to know, is if you have an HSA through work. Now, if you are the spouse and you are not the employee, it's the employee. So sometimes they'll say, well, my wife is, I am the employee, I can still make a contribution because I'm not going on Medicare. That's correct. However, the spouse, if they're not the employee, they can go on Medicare A and B, but they cannot make that contribution. So there's a little bit of confusion when it comes to HSAs, and I do wish financial planners would make people aware of this when they meet with them. Oh, okay. It says you can contribute to an HSA until you enroll in Medicare, even when you're not working. You may continue to withdraw money from your HSA after you enroll in Medicare to help pay for medical expenses. You can use the money in your HSA, but you cannot make a contribution.
Right.
Okay, this is where I'm going to turn it over to Mary Kay, because I am not familiar with FSA.
Okay, so regarding the FSAs, this is different from an HSA in that as long as you're employed, you can continue to make contributions to the FSA, even if you are enrolled in Medicare. So the rules on the FSA are quite a bit different. And also, once you turn 65, you'll be able to use your account to pay for things other than medical expenses without a penalty. You wouldn't, if it is not a medically qualified expense, you would have taxes, but you wouldn't be penalized. You can use the funds from your FSA to pay for eligible medical costs for both your spouse and any tax dependents that you take on your income taxes. So the FSA is quite a bit different than the HSA. There's a lot more flexibility in that. And also, when you retire, you can, as I said, continue to make contributions to the FSA, but it'll be on an after-tax basis. And with the FSA, as it is now, your account will remain open until the following March 31st, just as with under 65 people. So that rule is the same. Okay, so thanks, Mary Kay.
Decisions for Medicare eligible workers, working past 65. There's a little bit confusion for people here. Workers who are turning age 65 and work for an organization with fewer than 20 employees must enroll in Medicare as their primary health insurance. Those working at organizations with 20 or more employees may choose whether to enroll in Medicare before retiring. So to simplify this, if you have less than 20 employees and you have an employee that is turning 65, they do need to sign up for Medicare, and Medicare will be their primary. Then the option for them is, do they keep their company plan as their secondary, or they can opt out and go on a standalone plan. But when somebody has less than 20 employees, they do need to have them go on Medicare. However, if there are over 20 employees, then they can be on the employer plan and Medicare can be secondary. However, this is where we do recommend that people do a comparison, because they could also opt out of the company plan and have Medicare as their primary, and then be on a Medicare supplement or Advantage plan. And again, there is no cost or obligation, and we have no problem telling people if their employer plan is really good, you may want to stay there because it's a really good plan. And I will tell you, although I think probably a lot of you may already know this, and I was not aware of this when I started this side of the business, but Northeast Ohio is considered one of the hotspots nationally of Medicare eligible people. People are coming back to Northeast Ohio that are Medicare eligible because of our healthcare system. So that makes things rather competitive for the insurance carriers that work with Medicare. So Medicare beneficiaries are finding out, wow, maybe going on Medicare with the plan as opposed to being on the company plan is not such a bad thing, because there's a lot of competition in the area. When can I change my coverage? Annual enrollment. Many of you will see the commercials, and the commercials are all about Medicare, because somebody who is on Medicare now with a plan, if they want to make a change, it's between October 15th and December 7th. So as of last Friday, those of us that represent Medicare plans could start talking about the 2022 plans. We can't start writing plans to change until October 15th, and the paperwork must be submitted by December 7th. It will not go into effect until January 1st. And one thing I want you to know is, if you have an employee who has a mother, a father, a sibling, or somebody that says, I need your help, please let your employee know that they can reach out to us, and we will help them to understand what their options are. Additional enrollment period, special enrollment period. You can make changes to your Medicare Advantage and Medicare prescription drug coverage when certain events happen. There are rules about when you can make a change. To simplify that means, okay, we are leaving the state of Ohio, my plan doesn't go with us. What can I do? We've come into the state of Ohio, my plan didn't come with us. We just inherited a lot of money and my income has changed. We just lost a lot of money and now we're low income subsidy. With somebody in the family's moved into a nursing home, somebody in the family has moved out of a nursing home, or I'm over 65 and leaving my employer plan. Those are all a variety of different special enrollment periods when somebody can, if they meet specific requirements, can go on Medicare outside of the enrollment period. Then there is what's called a Medicare Advantage open enrollment period. You will not see advertisement about this. We are not allowed to market it. But between January 1st and March 31st, if somebody is on a Medicare Advantage plan and they want to make a change, they can make one change. What does that mean? During annual enrollment, October 15th to December 7th, somebody could literally change their plan every day. And whatever paperwork plan was in on December 7th, that's the plan that they would go on. If you make a change between January 1st and March 31st, you are allowed to make one change. Whatever that change is, that's it for you for the following year. Okay, what can I do? Okay, there's a lot of things that can be done. We can review benefits program. We can educate Medicare eligible employees. Encourage employees to create a Social Security account. Again, that's financial. Sometimes it's beneficial, sometimes it's not, but that really depends on everybody's individual situation. You can help employees understand how the company's retirement program works. Leverage the company's 401 plan and group health plan administrators. Consider providing retirement/Medicare educational seminars. Provide Medicare and Social Security literature and handouts. So one of the things that you can do in regards to Medicare is you are not allowed to direct people to Medicare. However, you are allowed to bring somebody in who can educate them about Medicare and if in fact they should do anything, and if they want to do anything, what can they do? And there is no cost or obligation for us to do it. We can do it as a coffee in the morning. We can do it as a lunch and learn. We do it a variety of ways. But to take the burden off of you as an HR person, we can come in and we can talk about it for you and at least provide answers that you may need to get. And there are a variety of resources available. They can go to Medicare, they can go to Social Security, they can go to Ohio Department of Insurance. Now, I will tell you that if you call Medicare to sign up for Medicare A and B, they're going to tell you to call Social Security. However, if you call Social Security to sign up for Medicare A and B and they say, tell me about Medicare, they're going to tell you to call Medicare. So there's a little bit of confusion there. So another easy way to do it is either to call your representative through the Fidelity Group or just give Kaz Company a call direct, and we can try and ease the confusion and answer the questions. I think we may have had one or two questions come in.
Yeah, Kathy, thank you so much for this presentation. Every time you walk through this, how complex Medicare is, I learned something new. I'm sure our listeners did too. And I know we have a couple questions that came through in the chat box. So I'm going to review them. One, I have an employee with high claims who has now turned 65. How can I incentivize this employee to go on Medicare?
Okay, employers are not allowed to give an employee an incentive to go on Medicare. They are not allowed to do that. What you could do is just either have somebody from my team come in and say, I'm going to have somebody come here and explain your options to you, because we then take the burden off of you, the HR person, and can possibly show them that they may be quite surprised at the coverage they get, and that there is no obligation for them to sit down with us. But you cannot give somebody an incentive. It is not allowed.
Okay, another question. Can an employee be on Medicare and the employer's sponsored health plan at the same time? Is there any benefit to this?
Okay, so if it's over 20 employees, they would be on the employer plan as primary, and they could do Medicare as secondary. If it's less than 20 employees, they'll be on Medicare as primary, and the employer plan is secondary. Okay, so they flip. So if it's under 20 employees, they're on Medicare, and then they can do the employer plan if they want. Or if they're over 20 employees, the employer plan would be first, Medicare could be secondary. However, if they go on Medicare and then they go on a plan with Medicare away from the employer plan, there is no reason for them to be on the company plan because now they're paying for something they're not going to use.
Perfect. How long after a qualifying event do you have to enroll in Medicare? So,
okay, well, when you say qualifying event, what is the qualifying event? If you're talking about I've come off of an employer plan, you have 8 months to sign up for Medicare A and B, but I do recommend that you do it prior to because you want your employer coverage to end on one day and the Medicare to start the next day. But they have 63 days to get the Part D prescription plan or they're going to pay a penalty. So in essence, it's 2 months.
Perfect. Okay, that looks to be the last question. Thanks to those that submitted. Thank you for everyone for attending today's webinar. Kathy and her team would be happy to meet with you or any of your employees to answer any questions to help them prepare for this next phase in their lives. If you have any other questions, contact Kathy or your account manager at the Fidelity Group. Also, be on the lookout for a recording of today's webinar later this week. On behalf of the Fidelity Group and Kathy at Kaz Company, thank you for joining us today and have a great rest of your day. Thanks, everyone.